So welcome again to this webinar series on MH for All, which is hosted by United for Global Mental Health, together with the Lancet Psychiatry, the Mental Health Innovation Network, MHPSS.net, and the Global Mental Health Action Network. My name is Alberto Vázquez. I'm a Peruvian lawyer working on disability rights and mental health law, and I will be moderating today's discussion on the 2021 Agenda on Mental Health and Human Rights. I would like to remind you that this session is being recorded and it will last 45 minutes. So please feel free to tweet during the session. You can use the hashtag MH4all, and you can also send any questions you have by email or write them in the chat box. So 2 weeks ago, we started this conversation on human rights and mental health, looking at different human rights challenges affecting mental health services. For example, institutionalization, coercive practices, biomedical approaches, lack of community support, and also the lack of participation in decision-making of people with lived experience. Today, we will focus on the agenda for change. We will take a look at the 2021 Agenda for Human Rights and Mental Health and discuss new opportunities and tools coming out this year. To do this, we have another very strong panel. Today we have Michelle Funk. She's the head of the Policy, Law and Human Rights Unit at the Department of Mental Health and Substance Abuse at the World Health Organization. We also have Yvonne Owino-Wamari. She's a human rights defender from Nairobi, Kenya, and she works as the Africa Program Officer at Outright International, a leading LGBTIQ+ human rights organization. We also have Simon Vasseur-Bacle. He's a clinical psychologist, head of international affairs at the World Health Organization Collaborating Center for Research and Training in Mental Health in Lille, France. He also works at the Ministerial Delegation for Mental Health and Psychiatry in the French Ministry of Health. And finally, we have Tanja Kleinsorge. She's the head of the Secretariat of the Committee on Social Affairs, Health and Sustainable Development at the Parliamentary Assembly of the Council of Europe. Thanks to you all for being here with us. And let's start this discussion with Michelle. Michelle, the World Health Organization runs the Equality Rights Initiative, which you have been leading for several years now. Can you tell us more about this initiative and the success so far?
Yes, thank you very much. It's a pleasure to be here. Always happy to talk about quality rights, which is essentially a global initiative of the World Health Organization to improve the quality of care in mental health and social care services, and to promote the rights of people with mental health conditions and related disabilities. With quality rights, we work in several different areas. One key area is around building the capacity of different stakeholders to combat stigma and discrimination and to implement a human rights-based approach, which is aligned with the Convention on the Rights of Persons with Disabilities, also known as the CRPD. And this is a convention that most countries have signed up to and therefore are obliged to implement. A second key area of work is to support countries to develop community-based mental health services and supports that truly respect human rights and a person-centered recovery approach. Thirdly, Quality Rights is working with and in support of civil society to empower people with lived experience and others to conduct advocacy, specifically around integrating a human rights-based approach and to influence policy making in this direction. And fourthly, Quality Rights is supporting governments to reform policy and law in line with the CRPD and other international human rights standards. So let me just take the opportunity to highlight some successes achieved to date. Through Quality Rights, we've just launched a comprehensive set of training tools at the end of last year, which equips all stakeholder groups with the right knowledge, attitudes, and skills to implement a human rights-based approach on the ground, whether this be supporting a family member, working in government health services, or as a key national legislator, for example. And these training tools include materials for use in workshops, as well as an e-training platform that allows us to reach thousands of people in and across countries in order to change attitudes and practices on a large scale. As an example of its reach and success, within a couple of years, Ghana was able to successfully train 9,000 people, many health professionals, but also people with lived experience, NGOs, universities, and school students. And the outcomes have been quite remarkable in terms of the attitude and practice change achieved. Let me say, when I said at the end of last year, I meant the year before, but this year has somehow gone really quickly. Another recent outcome has been the wide-scale assessment of the main mental health services in 6 countries using the Quality Rights Assessment Toolkit. And importantly, these assessments are now being used as a basis for follow-up work to transform services using the Quality Rights Transformation Toolkit that we've developed. So transforming services into non-coercive services, services that are really respecting and promoting people's human rights, including the right to decide over their treatment and their lives. We also consider as a success the engagement of so many people with lived experience who have had a truly profound impact on all the tools that we have developed through this initiative. People with lived experience have had key roles also in the implementation of the initiative at country level, for example, in carrying out service assessments and contributing to service transformation, advocacy campaigns, and many other actions. And just finally, we expect that the new guidance on mental health related laws that we are currently working on will become a key tool to help countries create legal frameworks that comply with the CRPD and create a mental health system based on, again, support, inclusion, and that definitely see an end to the coercive practices that exist today. Thanks very much, Alberto.
Oh, Michelle, just a quick follow-up question. Where can people find this document? You mentioned many tools, assessment tools, training tools, and soon this guidance. Where can people find it?
They're all on the WHO website. If you search on WHO quality rights, training and guidance tools, you'll come to a page and you've got the whole list of tools there. There's also another site, which is the Quality Rights Country Implementation Portal, where you will not only find the tools, but you'll also find the incredible results of, and actions of countries, including many European and African countries, and they really showcase what they've put in place and some of the outcomes that they have achieved. And I'm happy in the follow-up email, if we send that out, we can send you the links to those tools as well.
Thank you, Michelle. Let's go to Yvonne. Yvonne, Outright International fights for the human rights of LGBTQI+ community. Can you tell us more about your work concerning mental health?
Thank you, and thank you so much for having me. So as you've mentioned, I am Owino-Wamari, and I'm the Africa Program Officer at Outright Action International, and I coordinate the anti-conversion therapy project, which we're implementing in Nigeria, Kenya, and South Africa, and I am based out of Nairobi, Kenya. So as Outright, first of all, we're a global organization which has been advancing the human rights of LGBTIQ individuals for 30 years now. We have our headquarters in New York, but we have staff and board members present in 5 continents: Asia, Africa, Central South America, Europe, and North America. Our work essentially, we carry out our work essentially in 3 primary strategies. Our research, which focuses on publications that shed light on immediate and long-term impacts of exclusion, discrimination, criminalization, and violence on the grounds of sexual orientation, gender identity, and expression. Our research work informs the advocacy initiative, which is our second strategy, advocacy initiatives that we implement to advance human rights of LGBTIQ individuals at a global level. We also work through movement resourcing, where we create support systems for LGBTIQ organizations and people from across the globe. So with regards to the mental health aspect, Outright brings considerable visibility to physical, emotional, psychological, and even the mental health impacts of human rights violations have on LGBTIQ individuals, and also LGBTIQ human rights defenders who have to be at the forefront of advancing these rights. So I'll give you an example, a few examples based on the projects that we are implementing in different regions. So within our Asia program, we have worked in 5 countries in Asia. In our work in Sri Lanka, we have resourced projects to train and capacitate mental health counselors so that LGBTIQ victims or survivors actually of gender-based violence can have access to LGBTI sensitized services. While in Philippines, we had developed a TOT training curriculum, a train of trainers curriculum, but we revised this curriculum to add a section that would teach first responders on how to provide psychological first aid to LGBTI people facing domestic and family violence and other types of gender-based violence. Within the Africa project that I'm currently coordinating, this would be two-pronged actually. First, Outright released a global report on so-called conversion therapy that looked into the prevalence of conversion therapy or SOGI change efforts, practices that happen. Soon after, then we launched the project in Africa to champion a complete ban on so-called conversion therapy in Kenya, Nigeria, and South Africa. This involves a lot of research into the nature and extent of conversion therapy or SOGI change effort practices within these 3 countries. And in the project's design, we have incorporated the expertise of psychologists within the 3 countries to support first the research component in which would include developing the questionnaires, review responses that we get from the respondents, just so that we could ensure that we do not re-traumatize the survivors, but also so that we can have ready response to the survivors who may be re-traumatized or survivors who do need or do require psychosocial support, either through group debriefings or through individual sessions with the psychologists that we have brought on board. My last example would be with regards to the COVID pandemic. And at the onset of the pandemic, Outright carried out a research to establish the impact of the COVID pandemic on LGBTIQ persons. So the purpose of this research was really just to get a snapshot from the very initial stages of the pandemic, to get a snapshot of or characterize how the global pandemic and the public health measures that were put in place to curb the transmissions were affecting the lives of LGBTIQ individuals and their movements. And from our findings, we found that, of course, there was devastation of livelihoods and rising food insecurity, disruption in healthcare, elevated risk of family and domestic violence, and increased isolation and anxiety. And this really just simply reinforced the position that LGBTIQ people suffer disproportionately and are often left behind as a result of discrimination, which is exasperated in times of crisis. And we really did see that. So in our response as Outright Action International, the respondents, first of all, during the research mentioned and spoke to how these effects ultimately affected their mental health of their mental health as well as mental health of LGBTIQ individuals within the regions that they operated or they work or they live. So we responded through a COVID emergency fund that we put in place to offer financial support to local organizations in Africa, Asia, Caribbean, MENA region, and the Pacific to cushion the effects of the pandemic through the provision of food or medical assistance, but that also included psychosocial support for those who were affected or traumatized during this particular period in time. And through that grant, we actually managed to reach about 17,380 people, individuals. So yeah, so I'll just stop there.
No, thank you, and thank you for raising the issue of the links between stigma and discrimination and mental health. Simone, let me ask you about the Global Ministerial Mental Health Summit. The last Ministerial Summit was hosted by the Netherlands and had a focus on mental health and psychosocial support. So this year's summit is being hosted by the Ministry of Health of France. So can you tell us about your plans for this event and what are the expectations?
Yeah, sure. Hi, Alberto. Good afternoon, everyone. Do you hear me well first? Yeah, perfect. On behalf of Olivier Véran, Ministry of Health, and Franck Bellivier, the Ministerial Delegate for Mental Health and Psychiatry, we are very happy to host this Mental Health Summit in Paris. As you know, maybe the summit was planned in 2020, but we obviously had to postpone it. So that's it. The summit will take place in Paris, 5 and 6 October 2021. And as we will discuss it today, we think that 2021 will be an important year for mental health, with a strong focus on human rights. Indeed, there will be a momentum in October with at the international level the World Mental Health Day, October 10, as you all know, but also at the French level. We have the weeks of information on mental health, and with this year, the theme for my mental health, let's respect my rights, and those weeks will be from October 4 to 17. So after this bit of teasing, the theme of the Paris Summit will be Mind the Rights Now, and you're right, Alberto, this is the link with the Amsterdam Summit, which was called Mind the Mind Now. It will be the third summit of this kind of the Alliance after London 2018 and Amsterdam 2019, which were on different topics. But we want to work in a sustainable perspective with actors of these previous summits to maintain a momentum and create opportunities. I think it's really important, opportunities for concrete actions to promote mental health and quality mental health care. The program of this summit will, of course, take into account the current health context, because it has further revealed the vulnerabilities linked to mental health in the general population. And because this situation requires to support the promotion of mental health in national and in international health policies. So we think that it is crucial, of course, but it's not enough. That's why we chose the overall theme of the rights in mental health, because we think human rights promotion is not only an end, but also a powerful lever for the evolution of these policies. So the 2 days of the summit will feature plenary sessions and very important sharing experience workshops with this general objective of this summit to foster exchanges between professionals, persons with lived experience, mental health service users, family carers, the civil society with NGOs and associations, and of course also policymakers, in order to accelerate the evolution of practices in psychiatry and mental health based on innovative international experiences. So we want to bring together these international actors to work on these subjects with ministers of health, of course, but in cooperation with foreign affairs and also possibly education, social affairs, to ensure the political backing of the actions to be considered. So to sum up, we imagine this summit as an opportunity to, of course, promote rights in mental health, but also disseminate inspiring actions existing throughout the world, share enthusiastic experiences, highlight the levers to use, and also promote several deliverables to ensure this sustainable perspective and sustainable actions after the summit. Thanks.
Thank you, and it's great to hear about this important focus you're going to have on human rights and mental health during the summit. I think it's good to see how the ministerial summit is evolving. Tanja, you work at the Parliamentary Assembly of the Council of Europe, and many people maybe is not familiar with the work of this body. So can you tell us about the work of the Committee on Social Affairs, Health and Sustainable Development on mental health, and what are your priorities this year and why?
Yes, thank you very much for having me here. I am standing in today for our rapporteur on deinstitutionalization, Mrs. de Bruyn-Weseman. And she's today taking part in an urgent debate in the Dutch Senate. Our Parliamentary Assembly of the Council of Europe is in fact composed of delegations from national parliaments. So we have 47 member states in the Council of Europe, and that's also 47 national delegations from the national parliaments. This year is an important year for mental health in the Parliamentary Assembly. This is because we will be laying the groundwork for two key reports. The report on deinstitutionalization, for which Mr. de Bruyn-Weseman is the rapporteur, and an opinion for the Council of Europe's Committee of Ministers on the draft additional protocol to the Oviedo Convention on involuntary measures in psychiatry. You already talked about that draft a little bit 2 weeks ago, so people can perhaps refer back to that last webinar you had on that. So these two reports are of course linked. We all know that involuntary placement and involuntary treatment within mental health care services can affect the most fundamental rights of a human being, including the right to integrity and the right to liberty. The Assembly believes that ending coercion in mental health is the way forward to safeguard human rights and mental health. Deinstitutionalization is a valuable means to this end. The Parliamentary Assembly started working on human rights and mental health several years ago, in 2013 to be exact, when the Council of Europe's Committee on Bioethics started working on drawing up this additional protocol to the Oviedo Convention on involuntary measures in psychiatry. Already in 2016, the Assembly adopted a recommendation making the case against a Council of Europe legal instrument on involuntary measures in psychiatry. In this recommendation, the Assembly recommended that the Committee of Ministers instruct the Committee on Bioethics, and I cite, to withdraw the proposal to draw up an additional protocol and to instead focus its work on promoting alternatives to involuntary measures in psychiatry, including by devising measures to increase the involvement of persons with psychosocial disabilities in decisions affecting their health. End of quote. The Assembly essentially repeated these recommendations last year in Resolution 2158, unanimously adopted, on ending coercion in mental health, the need for a human rights-based approach. However, the Committee of Ministers did not heed the central recommendation of the Assembly, which is also supported by the Council of Europe Commission on Human Rights, to redirect efforts from work on the additional protocol to work on voluntary measures. Work on the additional protocol has continued and indeed will probably be finalized this year within the Committee on Bioethics. But the Assembly's recommendations did have an impact. Guidelines on ending coercion in mental health are also now currently being drafted by the Committee on Bioethics. These guidelines will showcase positive examples of voluntary measures, including successful deinstitutionalization of people with disabilities. Our rapporteur believes that these guidelines will serve as an encouragement to member states to start to transition to end coercion in mental health. She hopes that member states will realise that voluntary measures work where involuntary measures do not, and that they are cheaper into the bargain, as well as more human rights compliant.
Thank you, and thank you for reminding us these risks that pose this draft protocol to the Villa Convention on bioethics, which contradicts the Convention on the Rights of Persons with Disabilities, and we hope we will have enough political support to stop that process. Michelle, let me go back to you. You mentioned actually a new document, a good practice guidance on rights-based community mental health services. Can you tell us more about this document that is coming out this year? Michelle, you need to unmute.
Thanks. I was just saying, thank you very much. I was just saying that I'm really pleased to, I can see now in the landscape several other initiatives which are moving towards ending, good practices for eliminating coercive practices in mental health. So it's really good that this is happening, not just with us at WHO, but in other organizations. So we're really excited to announce that we are close to finalizing and launching a new report and guidance on good practice rights-based community mental health services from around the world. It's really important to emphasize that community mental health services aren't good enough, that they're based in the community, but they really have to be specifically rights-based. Anyway, the launch date that we've set is May 11th this year. And there is an overall document which introduces the concepts of human rights, the CRPD, person-centered recovery-oriented care. This overall document features and describes a selection of services from around the world that meet very strict human rights-based criteria. Different categories of services are showcased in the document, including crisis services, peer support services, outreach services, hospital-based services, community mental health centers, supported living services, as well as networks of all these different types of services working together. The guidance also discusses the important interface between all these mental health services with the social sector and social protection. And then it concludes with a set of recommendations for integrating rights-based services into the health and social sectors. There are also 7 accompanying technical packages where people can go if they want more detailed information, and each technical package focuses on one of the service categories that I mentioned. So for example, there will be a technical package on crisis services, a technical package on community outreach services, peer support, and so on. But in these technical packages, you'll have a lot more detail than what can be found in the overall document. And in addition, what we've done is mapped out key action steps for people to go through from idea to demonstration project of a good practice service. It's important to note that when we're talking about the rights-based services, we mean services that do not use coercive practices such as forced treatment, seclusion, and restraint, services that support people to make their own decisions about their treatment and care and that respect the choices that people make, services that promote participation, for example, engaging people with lived experience in the co-delivery of the service and training of its staff, and as well as being responsive to the feedback provided by people using the service in order to continually improve the service. And finally, that services, it means services that promote community inclusion, addressing all important areas of a person's life that they want to work on, including relationships, work, family, education, rather than just having a narrow focus on symptom reduction. So in a nutshell, the idea with this new WHO guidance is to inspire policymakers, healthcare planners, service providers, and others to develop and invest in new services that truly meet people's needs, while at the same time fully respecting their rights and effectively supporting them in their recovery journey.
Thank you, Michelle. We're really looking forward to it. Yvonne, you mentioned the work you were doing, and very important work in terms of challenging conversion therapies. And actually in the chat, we got some questions about how this is happening in the Philippines, for example. But tell us first, how does Outright's plans for 2021 engage with this intersection between mental health and human rights?
Thank you once again. So as Outright, we will continue to, of course, incorporate the very specific steps for, implementing mental health as part of like movement stability. So be it through our safety, security, and wellness trainings for LGBTI advocates and individuals, be it through the manuals that we are going to develop, or through research that would ultimately provide maybe policy recommendations. So for the program that we are implementing in Asia, one of the objectives of what we have established an Asia regional network on SOGI and gender-based violence is to develop a support mechanism for LGBTIQ advocates working to stop gender-based violence, and this will include domestic and family violence. And the support system that we're looking to put in place will include a response to trauma, to ensure mental health of LGBTIQ individuals is maintained. Within our conversion practices project in Africa, quite similar to the Asia program, again, there's work being done towards the development of a rapid response mechanism for survivors of conversion practices. This would be one of the interventions, would be offering psychosocial support to the survivors, and also information necessary to support the mental well-being of the survivors. This is something that is already being incorporated in the project in Kenya, and it's mainly just working towards tightening this and making it sustainable. Conversion practices are usually carried out in the name of religion and pseudoscience. That's what the Outright research that we did found. So there's definitely need to engage with medical and psychologist associations within the countries that we are implementing the project in, and broadly and beyond at a global level and at a regional level as well. So that is what we are currently doing, and essentially this is just to be able to bring them on board as allies in challenging conversion practices, so that we can work towards ensuring regulation of the sector to mitigate against harmful practices that are being carried out in some instances by mental health professionals. With regards to with regards to the conversion practices, one thing that Outright is actively working on right now is hosting an experts meeting on pathways for burning SOGI change efforts or conversion practices. This will be a multidisciplinary consultation which will bring together LGBTIQ activists, SOGI change efforts survivors, legal, medical professionals, and faith, religious, and traditional leaders, to a roundtable where we can identify a set of legal and faith-based human rights and mental health policy pathways for eliminating SOGI change practices. So this is going to be done next month. With regards to the COVID pandemic that I had spoken about earlier, we still realize that LGBTQ persons are still very hard hit by the COVID pandemic. And given the overwhelming need for support from LGBTIQ organizations at local level who need that cushioning to be able to support the communities that they work to serve, we will be reopening a call for applications for the second round of COVID emergency grants, which should be, I guess, sometime next month, not quite sure. And we do anticipate that the requests will definitely come through, and they will definitely be requesting for mental health support. So from our first fund, we received over 1,500 applications, but we managed to support 125 applications. So we do anticipate that we're going to get a very large number of applications yet again, and hopefully try and support as many as we can.
Thank you. Thank you, Yvonne, for this important work. Simon, you kind of answered my question in the first round, but maybe you can highlight a little bit more how human rights will be addressed at the Global Ministerial Health Summit.
Yeah, sure. The good news is that the theme of rights and mental health is receiving growing national and international attention. So this question is not being raised by all over the world and is in line with, we mentioned some of those international texts and programs. So we designed two thematic axes for this summit with the International Steering Committee. And the first one will discuss the place of mental health in global health during and after the current health situation. It will address the health context, which is obviously a demand from many actors. And we think we have to integrate the issues raised by this situation, and also to highlight the global issues of mental health and the impact for the most vulnerable during this crisis. That being said, one objective of this first part of the program will be to identify the levers for action by discussing global topics, investments, mental health and global funds, universal health coverage, MHPSS, so mental health and psychosocial support. And of course, human rights will be also evoked in this axis through the prism of access to care, but access to quality care, and how we can use the related international tools such as CRPD, WHO resolutions, UN reports, or WHO Quality Rights Program. The second axis will highlight very concrete, innovative practices on rights and in mental health. It will present French and international initiatives promoting the respect of rights in mental health care pathways, whether they are carried by professionals or by civil society or jointly, but also by political decision makers, for example, through legislative changes. So this need to share experiences is essential. Indeed, those challenges are high, and meeting them requires ambition and a high level of expertise. However, there are many experiences in France and throughout the world that demonstrate the feasibility of innovative practices in psychiatry and mental health with recovery-oriented perspective and community-based. And we think it makes it possible to reach the high standards of international texts and conventions. So we think that a progressive and positive positioning must be the DNA of this summit, enriched by international partners and experiences. And indeed, this international dynamic has never been so promising. So given the number of initiatives that are emerging, the number of voices that are raised to testify, advocate for greater respect for mental health rights. This international context is very important. It's also, we have to say, not so easy to speak and to talk about. But this prism of rights offers a transversal and unifying perspective. It must benefit to all actors. For example, we think that the promotion of users' rights is also an opportunity to improve the professional life of mental health professional at work, for example. And so to conclude, the respect of rights should be a common objective, and we want to underline this during the summit.
Thank you, and wish you good luck on the summit, and I hope we get some very high-level commitments on this topic of human rights. Tanja, you mentioned that the committees on social affairs, health, and sustainable development is working now on this report on the institutionalization of persons with disabilities. Can you tell us about the purpose and the scope of this report, and what do you think is going to be the impact?
Yes, thank you. This report is in fact a follow-up to Mr. Bruins-Wiesemann's last report on ending coercion in mental health, the need for a rights-based approach, as deinstitutionalization is a key stepping stone to ending coercion in mental health. Institutionalization is increasingly acknowledged as poor policy and a potential violation of human rights. The UNCPRD, as well as other human rights instruments, have enabled a shift to a human rights-based approach to this issue. For residents and institutions, neglect and inadequate health care is too often a reality. Persons with disabilities who are placed in institutions are deprived of their liberty for long periods of time, and in some cases even for a lifetime. Most of them are institutionalized against their will or without their free and informed consent. It is important to have in mind that these persons are some of the most vulnerable in our society, and I think the COVID-19 pandemic in which they have been disproportionately affected has really highlighted that. The process of deinstitutionalization requires a long-term strategy that ensures that good quality care is available in community settings. As institutionalized persons are being reintegrated into society, there is need for comprehensive social services and individualized support in the deinstitutionalization process in order to support these persons, and in many cases their families or other carers. Such support must be accompanied by specific access to services outside institutions, enabling people to obtain care, work, social assistance and housing, thus also addressing the social determinants of health. If deinstitutionalization is not managed properly and without due consideration of the special needs of each person concerned, this can have unfortunate consequences. The lack of support and monitoring can lead to abuse and violence or a return to institutions. Several Council of Europe member states still hesitate to close down residential institutions and develop community-based services for persons with disabilities. In some countries, the numbers are in fact increasing, in spite of international obligations and long-standing calls from international human rights bodies to end such practices. Mr. Bruins-Wiesemann's report will shed light on and give a better understanding of the living conditions of persons with disabilities in institutions. She wants to engage with individuals and NGOs to propose recommendations to member states on how to provide appropriate community-based services. And the rapporteur would also like to explore the possibility of further supporting member states who need it in their processes of deinstitutionalization through the Council of Europe Development Bank. She also certainly be looking at what WHO is preparing at the moment for May. Amongst other things, she's also going to be organizing a hearing on 16th of March at our committee meeting. That hearing is going to take place at 2 p.m. and it's aimed at gathering information from human rights experts and NGOs and people with lived experience. It will be public, so everybody's more than welcome to follow it. And if you're interested in more information about the report, the Committee on Social Affairs, Health and Sustainable Development, which I work for, has already considered and declassified an introductory memorandum, and so you can find that on our website. If you go onto our website, then the General Parliamentary Assembly of the Council of Europe website, there's a web page just for our committee, and it has a list of everything that is public of our reports.
Thank you. We're over time, but I'm going to give you 10 seconds, 15 seconds, 20 seconds each, just to answer this very fast question in terms of, very easy question in terms, do you anticipate the COVID pandemic will help to better integrate human rights into mental health? Michelle.
Great. It will if we make the effort to promote it and make it happen. Just having COVID and increased awareness of mental health may just actually lead to a exacerbation of the existing model, treatment, services, policies and laws. So we really need to we all need to say together, no, if we're moving forward, we're building back better, we need to specifically integrate human rights into policy, laws, services, training, education, and all the different areas that build an effective system, mental health system. Thanks.
Yvonne, short, what do you think?
I'm sorry, I lost you. I didn't get the question. Could you kindly repeat it for me?
Do you think the COVID pandemic will help to better integrate human rights in mental health agenda, in the mental health agenda?
Sorry, I think that if we all need to be involved in decision-making processes that will ultimately ensure that nobody is left behind when coming up with interventions and ways in which to better manage the situation. So bring everybody to the table and have an all-inclusive discussion on how to respond to the effects or the impact that it is having on the diverse, the diversity that we are as human beings, and essentially that will enable the responses to be all-inclusive and nobody will be left behind.
Thank you. Simon.
So the answer is a big yes. First, because it seems that more and more people are now aware of their own mental health. We also know that we have tools to act on this topic, and that we need to invest in mental health, of course, and conclude with all the experiences that would be shared during the summit in October in Paris. I'm sure that we will definitely be able to say that this change is possible.
Tanja.
It's my personal opinion that it's not all rosy, because the COVID-19 pandemic has basically created more human rights challenges, not just in mental health, but also in general. And our committee has done a lot of work on COVID-19 and human rights, and so has the Council of Europe as a whole. And I am still optimistic in that the time for really recognizing human rights and mental health has come. And I think, yeah, we're fighting a backlash against human rights in general, but I think we're winning it.
Thank you. And I think the fact that you're working on this individualization, I think shows that there is a momentum also created by the pandemic to discuss new ways to provide support and services. And 2 weeks ago, we talked about human rights violations in mental health, and today we heard some of the actions that are actually being implemented to address them. And I think it has been great to listen to you all. Thank you very much. And I think we have learned a lot from you. And I believe today's conversation also showed that there is still much to be done, but that there is willingness at international level to integrate human rights in mental health. And I think there is also a growing acknowledgement of the contribution of the Convention on the Rights of Persons with Disabilities and its impact in this field, and as well as the potential of participatory processes. And we need to involve advocates and experts with psychosocial disabilities and lived experience in these efforts. And I think experience shows us again and again that participatory processes produce better outcomes for all. And I think we can conciliate different perspectives when there is the space to do so. So thank you again to all of you, the panelists, the organizers, and everybody following us. The recording and notes of the session will be posted at the United for Global Mental Health website very shortly. Let's continue this discussion on social media using the hashtag MH4All. The next session will be on the 9th of April and will focus on prisons and institutions. People can register at the website and please submit your questions in advance. Thank you, everybody, and have a good afternoon.
Good afternoon. Bye.